Hello, everyone. I'm Dr. Deborah Wilson, a board-certified geriatrician. Over many years of working with adults over the age of 60, I've noticed something important. Many health issues that we often attribute to just getting older are actually related to vitamin deficiencies. Here is a statistic that surprises many people. Nearly half of adults over age 65 have at least one vitamin level that is low or suboptimal, and most of them don't know it. As we age, our bodies change in several ways. The stomach produces less acid, which reduces the absorption of certain vitamins. Kidney function declines, affecting how vitamins are converted into their active forms. The skin becomes less efficient at producing vitamin D when exposed to sunlight. Appetite may decrease and diets may become less varied. In addition, many medications commonly used for chronic conditions can interfere with vitamin absorption and metabolism. The important thing to understand is that vitamin deficiencies often do not cause obvious symptoms at first. They can develop slowly over months or even years. You might simply notice feeling a little more tired than usual, less steady when walking, more forgetful, occasional tingling in the hands or feet. And it's easy to assume these changes are just a normal part of aging. But in many cases, the body is signaling that it is missing something essential. Today, I'm going to focus on 3 vitamins that are especially important in older adults: vitamin D, vitamin B12, and vitamin B and E. Let's begin with the vitamin most directly linked to bone health and fall risk, vitamin D. If I had to choose the vitamin most commonly deficient in older adults, it would be vitamin D. Vitamin D plays a critical role in helping the body absorb calcium. Without adequate vitamin D, bones cannot maintain their density and strength, even if calcium intake is sufficient. But vitamin D does more than support bones. It also plays a key role in muscle function. Research shows that low vitamin D levels are associated with reduced muscle strength, poor balance, increased risk of falls. And as we know, falls in older adults can lead to serious consequences such as hip fractures, prolonged hospitalization, and loss of independence. Why are older adults more likely to be deficient in vitamin D? There are 3 primary reasons. First, aging skin produces less vitamin D when exposed to sunlight. Second, many older adults spend less time outdoors, especially during colder months. Third, the kidneys, which convert vitamin D into its active form, become less efficient over time. As a result, vitamin D levels can gradually decline without obvious symptoms. Some individuals may experience bone discomfort, muscle weakness, difficulty standing up from a chair, unsteady walking. However, many people do not experience noticeable symptoms until a fracture occurs. A simple blood test measuring 2,5 hydroxyvitamin D can assess vitamin D status. In the United States, levels above 30 ng/ml are often considered adequate. For adults over 65 who are at risk for deficiency, many guidelines recommend supplementation of approximately 800 to 1,000 IU per day. It's important not to take very high doses long term without medical supervision, as excessive vitamin D can lead to elevated calcium levels. Vitamin D protects bones and helps reduce fall risk, but bones are not the only concern when it comes to vitamin health in older adults. Another vitamin that directly affects nerve function and memory and is often overlooked is vitamin B12. If vitamin D supports bones and muscles, vitamin B12 supports the nervous system and cognitive function. Vitamin B12 is essential for red blood cell production, maintaining the protective myelin sheath around nerves, DNA synthesis. The myelin sheath acts like insulation around electrical wiring. When B12 is deficient, this protective layer can be damaged, impairing nerve signal transmission. Vitamin B12 deficiency is relatively common in adults over 60. Studies suggest that approximately 10 to 20% of older adults have low or borderline B12 levels. Unlike vitamin D deficiency, B12 deficiency is usually not due to inadequate intake, it's due to decreased absorption. To absorb B12, the stomach must produce acid and a protein called intrinsic factor. With aging, stomach acid production declines. The stomach lining thins. Intrinsic factor production may decrease. In addition, commonly used medications, such as acid-reducing medications and metformin, can further reduce B12 absorption. You may eat sufficient meat, fish, and eggs, but your body may not absorb B12 effectively. Vitamin B12 deficiency can affect three major systems. First, the blood. It can cause anemia, leading to fatigue, pale skin, shortness of breath with exertion. Second, the peripheral nervous system. Symptoms may include numbness or tingling in the hands and feet, reduced sensation, unsteady walking. Third, the brain. Some individuals may notice increased forgetfulness, difficulty concentrating, slower processing speed, subtle mood changes. An important point: neurological symptoms may appear before anemia develops. That is why a normal blood count does not rule out B12 deficiency. A blood test measuring serum B12 levels is typically the first step. If results are borderline, a methylmalonic acid test may be ordered to confirm deficiency. The good news is that treatment is usually straightforward. Most cases can be treated with oral supplementation. In certain situations, injections may be recommended. Early detection is essential because prolonged nerve damage may not fully reverse. Vitamin B12 works closely with another vitamin, vitamin B9, also known as folate. Vitamin B9 and vitamin B12 work together in red blood cell production and in the metabolism of a substance called homocysteine. Folate is found in leafy green vegetables, legumes, and certain fruits. In the United States, many grain products are fortified with folic acid. Vitamin B9 is essential for red blood cell production, DNA synthesis, regulating homocysteine levels. If folate is deficient, the bone marrow cannot produce normal red blood cells, leading to a condition called macrocytic anemia. Symptoms may include fatigue, reduced stamina, pale skin, difficulty concentrating. Because B12 and folate both affect red blood cell production, their deficiencies can appear similar. Another important role of vitamin B9 is regulating homocysteine. Elevated homocysteine levels have been associated with cardiovascular risk. A critical caution: if someone is deficient in vitamin B12 but takes folate alone, anemia may improve, but nerve damage may continue silently. That is why we do not recommend taking high-dose folate without proper evaluation. The answer depends on the individual. Not everyone over 60 is deficient in all three vitamins. Clinical decisions should be based on DEET, medical history, medications, symptoms, laboratory results when appropriate. Some individuals may need vitamin D. Others may need B12. Some may benefit from a moderate dose multivitamin. The key principle is personalized supplementation, not automatic supplementation. More is not always better. Excess vitamin D can raise calcium levels. High-dose folate can mask B12 deficiency. Taking B12 when levels are already normal does not provide additional benefit. Many older adults take supplements based on advertisements, social media, or advice from friends. Common mistakes include assuming all vitamins are harmless at high doses, taking multiple products with overlapping ingredients, using folate without evaluating B12, believing supplements replace a healthy diet, not informing physicians about supplement use. Supplements can be helpful when used appropriately, but they should be used thoughtfully. The guiding principle is simple: supplement with purpose, not by habit. As we age, our bodies change. Vitamin deficiencies can develop quietly and may be mistaken for normal aging. Vitamin D supports bones and muscle strength. Vitamin B12 protects nerve function and cognition. Vitamin B9 supports blood production and cardiovascular metabolism. If you experience persistent fatigue, balance problems, numbness, or memory changes, don't assume it's just aging. Talk with your healthcare provider. Maintain a balanced diet. Supplement when appropriate. Use the right vitamin at the right dose for the right reason. Our goal in later life is not simply longevity. It is healthy longevity, maintaining independence, mobility, and mental clarity. If you found this information helpful, please subscribe and follow the channel for more evidence-based discussions on healthy aging. I'm Dr. Deborah Wilson. Thank you for watching. Wishing you continued health and well-being.